Hello, New Franklin families. It's Nurse Karen, and today I want to talk to you about some new questions on the daily health screening for students and just give you some more information about why the questions have changed. So I'm going to start by sharing my screen with you, and I want to show you some information. So let's find it here. I'm going to say we should come to. All right. Let's see. We are going to find right tab, and here it is. So as you know, you've been reporting out on new symptoms that might be experienced by your student. And I just wanted to share with you, this is some information that we received from the Department of Public Health, Dr. Benjamin Chan, and just a little presentation that was given to school nurses a couple weeks ago. And it talks a little bit about the symptoms of COVID-19 and the most common symptoms of COVID-19. And you can see on the list here, we have the usual suspect: fevers or chills, cough, shortness of breath, sore throat, nasal congestion and runny nose, fatigue, muscle or body aches, headache, new loss of taste or smell, nausea or vomiting, and diarrhea. So not too much new territory there, but I think an important piece that I thought you all might appreciate seeing is looking at the report of symptoms, the percentage of children who report certain symptoms here in New Hampshire. You can sort of ignore, you don't have to ignore the United States, but we're mostly looking at New Hampshire here. And they've got it broken down into two age groups, 0 to 9 and 10 to 19. How many COVID positive children were reporting symptoms. And if you look at the percentages here, you can see a little bit of differences between these age groups. For fever, we had 64% of children 0 to 9 complaining of a fever, where only 41% of children 10 to 19. So we definitely have a little bit of differences, and we can go down the list and you can see the differences between the age groups, and looking at young elementary students and older elementary students. And then if you have children at the middle and high school level, you can see that there are some differences in how the symptoms of COVID-19 present depending on the age. And that's really important. And as we come down here and we look at the top 5 symptoms by age group, oops, sorry, I went a little far. So you can see here, they break it down even further. And here we have our early elementary kids, and then our late elementary and middle school, and mostly our high school kids. And you can kind of see for our really little ones, a fever and a cough are going to be the top 2. And then there are a little bit of differences between the remaining common symptoms. But we definitely get a runny nose. Here in our school-age kids, 21% will have a runny nose. 21% will have a headache. When we get to our older school-age children, up into our middle school-age children, we have 42% with a fever, so fewer fevers, less coughs, but more headaches is the number 3 symptom. And runny nose sort of falls down towards the bottom of the list. And you'll definitely see a word here, myalgia, just meaning muscle aches, those body aches that people get. And if you have a child who happens to be high school age, you'll see actually the number 1 symptom is headache for those older children. So I think it's just an important piece for you to see as we go forward into looking at the health screening, why we want to know about such a variety of symptoms, and you know, why we have been advising so many people to seek COVID-19 testing. And so with that, I just want to take you down a little bit further here to the summary that Dr. Chan's office shared with us. And just, you know, we know that COVID-19 has a lot of different symptoms. They can be very mild and sort of look like a URI, an upper respiratory infection, like a common cold. We know that symptoms can be different based on age group. Fever and cough might be most common, but They can also begin their illness with some mild symptoms that look more like a cold. And really, the state has said we want to have a really low bar to ask school nurses to keep children home and advise testing. We want to have mild symptoms double checked to be absolutely sure, because we just know symptoms can be very different in our little ones. So with all that said, I just want to come to the New Franklin School Daily Screening tool, and I just want to talk about some changes. So not much has changed at the top. I'm still asking you to fill it out every day. Your student's going to be here for in-person learning, and to be thorough and to read the questions carefully and to try to get it in fairly early because I am trying to cross-reference as students are coming into the building to make sure everyone has been screened. So of course you're going to go ahead and fill out your student's last name. Oops, my typing, come on. And their first name. We're just going to use a hypothetical. And the person completing the form, well, of course, that's me. And your student's teacher. So all of this is the same. Let's choose Mrs. Patterson. This question about travel is the same. Has your student traveled outside of New England, which includes Maine, Vermont, New Hampshire, Connecticut, Massachusetts, and Rhode Island in the last 14 days or 2 weeks? And if you answer yes to that question, please keep your student home from school, and I will probably be calling you. Please know as we come into the travel season that if you're traveling outside of New England for the holidays, there will be a 14-day quarantine, so far as we know right now, upon returning to home here in New England. So please consider that. Give me a call if you have questions about that or if you already know you have travel plans. So let's go ahead and click next. And this question has not really changed. Has your child been around someone who tested positive for COVID-19 in the last 14 days? So if your child themselves have been exposed to someone who's tested positive for COVID-19, please keep them home if it's been 14 days or less, and I'll call you to discuss next steps. So here my child has not. And if someone else in your household is sick with new or unexplained symptoms, and that sick person has either traveled outside of New England in the last 2 weeks, or that sick person had contact with someone who you know tested positive for COVID-19 in the last 2 weeks, well then you need to keep your child home and I'll be calling you. So again, to reiterate, if someone at home in your household is sick with new symptoms and they have what we're calling a risk factor, which is travel outside of New England or exposure to a positive COVID case, even if your child feels well, you need to keep them home, and I will call you and we'll discuss next steps. If someone at home is sick and they have no risk factors, and your child is well, you can answer no to this question because they don't have the risk factors. They have to be sick with the risk factors to keep your child home. Moving on, I'm going to ask you to enter your child's temperature. As always, please be accurate and be sure that if it's 100 or higher that you keep them home, and I'll be giving you a call to talk about that. Now this question has been changed. Since the last time you filled out this form, has your child had any new symptoms of illness? What I'm trying to find out here is, because some of our New Franklin students are only coming into school 1 day a week, that means there's a potential in those 6 other days for that student to maybe come down with a mild illness and even recover before their next day of school. So if a child was in school on Monday and they're not due back until the following Monday, and they come down with a cold, say on Wednesday, but feel better by Saturday, well, mom and dad, when you're filling out that form on the next Monday, you might not even be thinking about those symptoms. I want you to start thinking about those symptoms that your child might have had since the last time you completed a form for them. And I want you to note whatever symptoms they might have had since the last time you completed that form for them. If they have no symptoms, then you will go ahead and check none, and your child will be coming to school today. Hooray. If they have new symptoms, then you will check the new symptoms and your child will not be coming to school today because they have new symptoms. If they had symptoms since their last day that they were in person learning at New Franklin, I'm going to ask that you take care of getting them tested for COVID-19 when they first become ill, and that if they have a negative result and they feel better and are fever-free for 24 hours, that only then will you send them back to school for their next in-person day, and please send me that negative test result as well. So again, the change here is if your child had been sick since the last time you filled out the form, particularly if it's been a week, I'm going to ask that you get them COVID tested and that you provide me with a negative test result. Still check off whatever symptoms they had, but then you can go ahead and check off that they're coming to school if you got that negative test result. If not, give me a call or I'll give you a call and we'll be talking about next steps. So here I'm going to say none. And then you will go ahead and submit as always. And I will be calling you sometime during the day to follow up. All right, the last thing I want to show you, just for information purposes, is a thing that I look at about, I don't know, 3 times a day anyway. And that is the COVID-19 dashboard for schools on the New Hampshire DHHS website. And it's here under Resources and Guidance, Schools. Or you can get it under Home, and there's an interactive map there. And that takes us to this school reporting tab. And you can see it lists the whole state by county and whether or not the level of transmission is minimal, that's green, moderate, yellow, or substantial, that's red. And then it breaks that down a little further. And you can drill down and you can check on Rockingham County because that's where we are. And you can see new cases are at about 90 per 100,000 in the last 2 weeks. And that 1.4% of the PCR tests are coming back positive in the last week. And if we click on Rockingham County, you should be able to see a list, takes a minute to load, a list of all the schools that are just in Rockingham County. And you can search by school town or search by school name, or you can just scroll through the schools to see what's happening in terms of COVID cases reported at schools. And you can see active, recovered, clusters, and then the last case reported. So this seems to take a few days of lag time to load in terms of data being updated, but you can definitely see we've had cases in school in Rockingham County in a variety of different districts, and you've probably even heard about some of them. I'm happy to report that none of them are in Portsmouth, and indeed we can search for New Franklin and see we've had 0 cases. So I just wanted to suggest, if you are wanting to keep track of that information yourself at home, that this is the place to do it. Again, it's at the New Hampshire Department of Health and Human Services COVID-19 dashboard. And the best way to find it, if you come to the home page, is to go to Interactive Analytics, and there you will see the school tab right there. All right. Okay, so I hope you enjoyed this little information tutorial session, and please feel free to reach out to me if you have questions. You can call me, you can email me. I will try to get back to you same day, just to try to make sure if you have questions, they're being answered. Remember, if you have any doubt, please keep your child home. They can always be brought in late after we talk. And look, I really appreciate everything you're doing to help keep COVID-19 out of our school and keep everybody healthy. And I'm just really pleased with how it's going. So thank you to all of you, and take care. Have a great weekend. Bye-bye.